Doctors are often alarmed when headlines spread fear. But what truly shocks heart specialists is not a single vegetable itself, it's how certain vegetables are eaten, prepared, and combined with existing health conditions. Many older adults hear dramatic claims like, "This vegetable raises stroke risk overnight," and panic sets in. A cardiac surgeon would want you to pause, breathe, and understand the full picture in calm, simple language, because fear is far more dangerous than knowledge. Vegetables are usually associated with good health, lower blood pressure, and better heart function. However, problems arise when a vegetable is heavily processed, loaded with salt, eaten in excessive amounts, or consumed without considering medications and existing conditions. This is where doctors become concerned, especially for seniors who already have high blood pressure, heart disease, diabetes, or a previous stroke. One major issue cardiologists talk about is sodium. Certain vegetables, and when preserved, pickled, canned, or fermented, can contain extremely high salt levels. Salt causes the body to hold on to water, which increases blood volume. When blood volume rises quickly, blood pressure can spike. In someone with fragile blood vessels or narrowed arteries, this sudden rise can increase the risk of a stroke. This is not something that happens because the vegetable is bad, but because the salt content overwhelms the body. Another concern involves vegetables that are high in nitrates. In natural amounts, nitrates from fresh vegetables can actually be beneficial, helping blood vessels relax. But when vegetables are processed or combined with preservatives, nitrates can behave differently in the body. For older adults with weakened circulation, these changes can lead to sudden blood pressure drops or fluctuations, which can be dangerous. Doctors are not saying to avoid these vegetables completely, but to be mindful of portion size and preparation. Cardiac surgeons also warn about vegetables rich in vitamin K. Vitamin K plays an important role in blood clotting. This becomes especially important for people taking blood-thinning medications. A sudden increase in vitamin K intake can interfere with these medications, making them less effective. This can raise the risk of clot formation, which may lead to a stroke. Again, the issue is not the vegetable itself, but sudden, unbalanced consumption without medical guidance. Doctors are shocked when they see patients who believed they were eating healthy, but were unknowingly putting themselves at risk. For example, someone may start eating large bowls of a certain leafy or preserved vegetable every night, thinking it will improve their health. Overnight, their blood pressure rises or their medication balance is disrupted. The next morning they feel dizzy, confused, or weak. These warning signs are often ignored until something serious happens. A cardiac surgeon would gently explain that the heart and brain are extremely sensitive to sudden changes. Older bodies do not adapt as quickly as younger ones. What seems harmless today can become risky if it creates imbalance. Consistency is key, and eating a wide variety of vegetables in moderate portions is far safer than focusing heavily on just one. Another overlooked factor is dehydration. Some vegetables have diuretic effects, meaning they cause the body to lose water. If an older adult eats large amounts of these vegetables without drinking enough fluids, blood can become thicker. Thick blood flows more slowly and can clot more easily, increasing stroke risk. This is especially dangerous overnight when the body is already slightly dehydrated from sleep. Doctors also talk about gut health and inflammation. Certain vegetables, especially when eaten raw or in large quantities, can cause bloating and digestive stress in older adults. This stress can trigger inflammation throughout the body, and chronic inflammation damages blood vessels over time, making them more prone to blockage or rupture. Again, the solution is balance, cooking methods, and listening to your body. A caring heart specialist would never want older adults to fear vegetables. Instead, they would encourage smart choices. Fresh vegetables are generally safer than canned or pickled ones. If using canned vegetables, rinsing them thoroughly can remove a large amount of excess salt. Cooking vegetables lightly can make them easier to digest and reduce sudden strain on the system. Portion control matters more than people realize. Even healthy foods can become harmful in excess. A plate filled half with vegetables is wonderful, but filling the entire plate with one specific vegetable every single day may not be ideal, especially if you are managing blood pressure or taking medication. Timing also matters. Eating very salty or heavy vegetable dishes late at night can raise blood pressure during sleep. Nighttime is when the body should be resting and repairing. If blood pressure spikes during this time, the brain is more vulnerable. Doctors often advise lighter, lower sodium meals in the evening to protect the heart and brain overnight. Family members should pay attention to subtle changes in older loved ones. Sudden headaches, blurred vision, dizziness, trouble speaking, or weakness on one side of the body are red flags. These symptoms require immediate medical attention. A vegetable did not cause the stroke alone, but it may have contributed to a chain reaction that tipped the balance. Cardiac surgeons emphasize communication with doctors. If you are planning to change your diet significantly, especially by increasing certain vegetables, it's wise to discuss it with your healthcare provider. This is particularly important if you take blood thinners, blood pressure medication, or have a history of heart or brain issues. Hydration should always accompany a vegetable-rich diet. Drinking enough water helps maintain healthy blood flow and prevents sudden thickening of the blood. Adding potassium, rich foods in balanced amounts can help counteract sodium's effects, but only under guidance if you have kidney or heart conditions. The most important message doctors want older adults and families to hear is this: there is no single oval vegetable. What shocks doctors is how misinformation spreads fear while ignoring context. Health is about balance, moderation, preparation, and individual needs. A warm, caring surgeon would remind you that food should support life, not create anxiety. Eating slowly, chewing well, and paying attention to how your body feels after meals can provide valuable clues. If something consistently makes you feel unwell, dizzy, or uncomfortable, it deserves attention. Vegetables are powerful allies for the heart when chosen and prepared wisely. They provide fiber, antioxidants, and nutrients that protect blood vessels and reduce inflammation. Problems arise only when extremes replace balance. Doctors are not shocked by vegetables. They are shocked by sudden changes, hidden salt, ignored medications, and fear-driven eating habits. Understanding this can protect not only your heart, but also your peace of mind. This message is meant to guide, not frighten. Knowledge empowers families to make safer choices together. When meals are built with variety, moderation, and awareness, vegetables remain one of the strongest defenses against heart disease and stroke, not the cause.